by walking to work. It's a long way. And then we put on scrubs to maintain the environment clean. We are not allowed to walk in with our outside clothes. So this is the scrub room where we scrub. We scrub first, we wash our hands and gown here so that we may go to the operating room. So we start off by washing our hands in this sink. And then we put on the gowns and the sets are in that shelf over there. Yeah, so this is the first place where we go to like wash hands. And then we were supposed to wipe every surface of the operating room. So this is the sterilization room. It is the central sterilization room where all the sterilization in the hospital is done. We sterilize gloves and equipments for surgical use. And the gauzes are for like wiping, for minor things, for wiping like blood or pus. And then this is the sluice room where dirty gowns and where the sets are packed from. Yeah. And then after standing for long hours in the operating room, we come here to rest. So here is where we eat, and so these are gauzes that pack. We cut them and then we pack them, and then they go to the sterilization center. So this is how they are cut. So remember to hit that subscribe button, like, share and comment. So we do this at our free time. So there are two operating rooms. There is this one with an automated table. So this one is an electricity automated table. It's used to do the major surgeries like laparoscopy. And then there is another theater. This theater is a manual operating table. It's used to do minor surgeries like appendectomy. So after a person is operated on, we take them to the recovery room, which is within the setup of the operating theater, so that they may recover and then be taken to the ward for further monitoring. So here are some memories we got to shoot while we were in the operating rotation.